we're at an academic center and we treat a lot of hepatitis C patients, but we started to look at how many patients were able to get their medications because we were getting some of the denials. So I looked at from October 2014 to about April of 2016. That's around the time when the direct-acting antivirals really came on the market. And so we looked at commercial patients, Medicaid patients, Medicare patients, and non-insured patients. So when we started getting the prior authorizations on the way, we have started noticing a trend of commercial insurance and Medicaid denying patients based on the less than F2 fibrosis score. We didn't see that as much with the Medicare patients, nor with the medication assistance program from the manufacturers, but we realized that that was our biggest reason for denials. My job is to, reassure the patient that these medications work well. I go over medication administration, how to take them, stress the importance of adherence, go over the side effects. But I also particularly go over the process of prior authorizations, because not a lot of patients has gotten a specialty medications before, and it's very different than just going and picking up your blood pressure medicine or your diabetes medicine. So I walk through the steps of the authorization process and how they will be receiving their medications through the specialty pharmacy. A lot of the times we would get a response back from the commercial insurance saying patient does not meet the medical necessity. And when we dig it a little bit deeper, most of the time it was the fibrosis restriction, or they were requiring additional lab work such as urine tox screen, or they were requiring a patient attestation or even a physician attestation that the patient has been clean and sober for the last 3 to 6 months. So if the patient was denied on less than F2 fibrosis, I wrote up an appeal stating all the significant morbidity and mortality benefits to treating early, and then sent that in. And then we found a lot of the times that insurance were willing to approve it, especially if the patient had other extrahepatic manifestations that they had compelling indications to be treated for. So what I do is when I anticipate a denial in clinic, when I meet with the patient, I walk through this process of what's going to happen, and I tell them in advance that this is what we will have to do in order to proceed with the next step of the process. Recently, June of this year, one of our commercial payers, Blue Cross Blue Shield of North Carolina, lifted the fibrosis restriction. So we were really pleased to hear that. So I'm hoping that in the future more insurance will lift the restrictions. Whenever I meet a patient in clinic that has low fibrosis and I anticipate a denial, such as Medicaid patients, I do try to encourage them to keep following up, to follow up with their liver care, and to see what else is going on with the insurance, because I believe it's going to change in the future. I just don't know when.